Hello, everyone. I'm Andrew Rentschler, the Senior Director of External Affairs at the Johns Hopkins Berman Institute of Bioethics. We're here today to discuss a paper this group has recently published titled Grappling with the Ethics of Social Distancing, a framework for evaluating social distancing policies and reopening plans. Let's get started. Your white paper focuses on the ethics of social distancing and reopening the economy. Why is this an ethics question and not a public health or an economics question?
Ethics is really what we turn to in order to think systematically about how we balance competing values and make decisions deliberately in light of our important values. So there's the value of saving the most lives in the short term, the value of protecting public health over the longer term, the value of protecting families' livelihoods, keeping children from sliding into poverty. So there's a range of competing values.
So an ethics framework is basically a tool that helps you to see the different sorts of ethical issues that are relevant, the kinds of issues that Anne was mentioning. And we draw heavily on the work of our colleagues Ruth Faden and Nancy Cass in developing this framework. So basically there are sort of two steps. The first is you sort of canvass the different sorts of interests at stake, and then you sort of go through and you assess what ought to be done.
That's great. Thanks, Justin. So, Justin, I'll stay with you. What are the major ethical issues here?
There's a lot. So, I mean, basically, we have the well-being of the entire country at stake and beyond. We have huge issues of liberty and privacy. So both the social distancing plans, which are policies which basically make us stay at home. Those are big infringements on our freedom of movement. And the new plans that are being put forward involve a lot of surveillance and invasions of our privacy. Now, they might be justified, but those surely raise sorts of ethical questions.
What we want to capture with our framework is, when are these unequal distributions of costs unfair or unjust? Especially noting when they fall disproportionately on people or members of groups who were already disadvantaged by our social and economic system.
Yeah, like my co-authors have expressed, we see here many of the ethical concerns typically raised and typically considered with public health policies: liberty, privacy, fairness, and we see them in a really extreme form. But what's so interesting and what's so hard about this issue is that it's not just these familiar issues and the familiar tensions between promoting public health and promoting the common good on the one hand and respecting individual liberty or privacy on the other hand that we see. It's not just those familiar tensions. What we see here is just extreme uncertainty and disagreement about how we promote the common good in this circumstance. And I think that makes this an unusually hard question in public health ethics, and one that gets into some pretty profound disagreement in our country about what does it mean to promote the common good? What is our conception of a flourishing society? What is our conception of what it is for the United States to flourish?
So a big part of what we're trying to argue is that, look, this is a morally tragic choice, and there are going to be really bad outcomes no matter what we choose. And so we should absolutely probably flatten the curve to some degree. That's why we have decided as a country to do some amount of social distancing. And we will have to open the country at some point so that we don't have the sorts of endemic poverty that will have terrible public health impacts. We don't have increases in domestic violence and addiction rates and drug overdose and child abuse, any of the sorts of things that might be flying under the radar to some degree now that will be exposed over the next 5 to 10 years. That's the sort of tragic trade-offs that we're having to think about right now.
What's the right answer here? When you apply your framework to the question of reopening, which plan's the right plan?
Let me say two quick things, and then my colleagues will say smarter things. So one is, we don't think it's the job of our paper to answer that question. Our job is to help people to see how hard the issue is and to see the benefits and burdens that are likely to attach to various policy packages or reopening plans so that they can think this through for themselves. So thing one, that's not the job of our paper. And thing two, it's almost certainly the case that amongst ourselves, we disagree on the answer to this question, which is part of why we engaged in the project.
Yeah, the question of when we start to reopen, how quickly we do it, how exactly we do it, is a question that our leaders, our policymakers will make. Many of these decisions are decisions that governors will make. And we hope that when they make these decisions, they have the infectious disease experts in the room to talk to them about social distancing and flattening the curve. And they have other public health experts in the room to talk to them about food insecurity and domestic violence and addiction. And they have economists in the room. And they have advocates for low-income people in the room. And they have representatives of a variety of communities in the room to make sure that they are seeing the whole picture. They're seeing the full set of cost and benefits with each policy option. And they're making sure that all the voices that should be heard are getting heard.
And just to add to what Anne said, it's really important more generally in a democratic country like ours that when there's profound disagreement about what we should do, that people get a say. And in this case in particular, there's profound disagreement about a choice or series of choices that are going to just shape our country for a very long time. And so it's really important that there's input from the public more generally so that everybody can have a say in shaping our future.
And adding to that, part of the goal of our project was to track the costs and track the unfair distribution of those costs from whatever policy results, in part so that we can remedy or repair injustice that's been done in the short term going into the future. So we've talked about examples, or some examples of effective remedies might be job training programs for people who lose their jobs, additional resources for education and for students who miss out on years of schooling or opportunities for more schooling or for employment after graduation. And I think it's important to recognize, as we've been saying, that the choices we make in reopening society are profound enough that they might amount to a new social contract for society as a whole. I mean, the choices we make in reopening society will shape the fabric of our country for decades, generations. And we hope that those choices will lead to a more just society, a more fair and equal society, rather than one that's less so.
I think this is a hard moral problem. I think this is one of the hardest moral problems our society has faced in my lifetime. And I hope that we can recognize that the answers aren't obvious and that there are legitimate, genuinely felt moral concerns and moral convictions on both sides of this debate, about reopening the economy now versus waiting. And I hope that we can listen to each other charitably and try and really grapple with the moral stakes in an open-minded and careful way.
The crisis right now seems overwhelming, and we need to be devoting a lot of time and energy to preventing COVID deaths and propping up our public health infrastructure as well as we can. But we need to set aside a chunk of time, 25% of our time and energy, to be thinking about the future too and planning for the future too, and coming up with programs that we can start game planning for and maybe start implementing that are going to help the people who are most adversely affected by this outbreak and by the policies that we put in place to fight it.
I'll add some, this is sort of getting at some of the things that Brian was saying, but I think what's really important is that leaders don't just consider their constituents who are loudest or most powerful or the upper middle class. I think that there are a lot of people who their interests aren't getting considered as much right now, and they're the ones who are suffering the most from the outbreak and the responses to it. And so I would really urge leaders to pay attention to individuals, especially from lower income backgrounds, communities of color, children who are not getting access to the essential services that they rely on from schools. I would urge leaders to consider those people's interests in particular. I think what would be really important is I would urge that in circumstances like these, leaders have all kinds of bad incentives to look for the quick fix or to do something that seems popular in the moment, so as to get reelected. If ever there's a time for leadership that rises above those sorts of incentives, this is that time. And I would urge leaders to make a decision that history would judge well and not that would be judged well at the polls in, say, November.
We've all been banging the drum that this problem is really hard, and it's going to involve trade-offs. And what that means is that any solution is imperfect. And that's why this problem is awful. Because whatever path we go down, there are going to be really severe costs. And the tendency by opponents is going to be to hang those costs around the neck of decision makers and further polarize us. And we absolutely can't let that happen, because the careful consideration and the moving forward is just going to involve tragedy, which means we need to think forwardly. We need to look ahead to think about how to mitigate those costs, how to remedy to the extent possible the people who lose something, and to just do our best at doing this in a reasonable, careful, thoughtful way.